Hi, I'm Jackie Downs, and I'm doing my project on the understaffing of nurses. Not having enough nurses tends to lead to a lot of negative things, including an increase in medication errors, falls, injuries, and preventable illnesses. It also contributes to a high turnover rate of nurses and a high burnout rate of those same nurses. Understaffing has been a long-lasting issue across the country and the world. For example, at a hospital in the Midwest, they did not have enough nurses to run the floor, so they were forced to shut down one of their wards and turn another into a self-help ward. The management conducted a survey and found that they had a high turnover rate because nurses were being overworked due to being understaffed. Unions in the U.S. are on the rise in healthcare facilities. More nurses are joining unions because they believe that it will increase the quality of care for their patients, which starts with increasing staff. Baby boomers are also contributing to the issue because they are reaching retirement age and needing more care. People are also living longer, as you can see in the graph. If this issue is not fixed, nurses will be overrun by people needing care. Many surveys have been done to find out how nurses feel about their nurse-to-patient ratios. One specifically was done in 2003 in Massachusetts. Out of 600 nurses, one-third believes understaffing leads to death. 87% also thought they had too many people to care for. 67% stated having medication errors. 64% said they had been seeing an increase in complications, and 54% stated an increase in patient readmissions. There are a lot of unhappy and burnt-out nurses. Their job dissatisfaction is 4 times higher than all other U.S. workers. Also, 1 out of 5 said they plan to quit their job within a year. Nurses have also complained about how low staffing limits their ability to perform their job ethically. Unhappy nurses is directly related to the continuous understaffing of nurses. This issue is important because if it is not recognized and fixed, it is only going to get worse. The baby boomers and those living longer will overrun medical staff and continue to reduce the quality of care. In addition, there are a lot of people not getting the care they need now, and that has to change as well. In July of 2002, the Department of Health and Human Services did projections on the lack of nurses. They predict that the U.S. will be 808,000 nurses short by 2020. This graph shows that the supply is going down as the demand grows very quickly, which is scary. The solutions I suggest is to have facilities require more education to management and to also enact policy changes in the U.S. If there is more education about the results of understaffing, then each facility can fix their issues without the need of policy change. However, that doesn't fix the issue for everywhere across the country. Therefore, policy change could require every medical facility to provide more education to their management as well as a higher minimum staffing level. If these changes are made, there will be improved quality of care, reduced injuries and illnesses, as well as reduced mistakes made by staff. These improvements will also help create happier and more productive employees.